Hello, good morning to everybody. My name is Luca Guardabassi. I'm professor of One Health AMR at the University of Copenhagen, and today I have the pleasure here to chair this very interesting, exciting workshop on antibiotic-free pork production, reality or chimera. We will try to answer this question during the workshop. I'm here as the coordinator of a European Innovation Action Project funded by the Horizon 2022 that is called AVANT. I will explain you in a minute what the project is about. But first of all, and I think you can put the slides on, I would like to remark what is the aim and also the expected outcome of this workshop, which is described also in the flyer that you have probably already seen. We would like to facilitate consensus and communication between all the parties involved in this type of production. So including farmers, veterinarians, producers, the food industry, regulatory agencies, and so on. And this is perfectly in line with this type of European project, which is not exactly a research project. Again, I will tell you shortly about the scope of the project. It's a typical multi-actor project, so we try to bring together all the relevant actors in the field so they can share their complementary backgrounds and their knowledge, their expertise to generate innovative solutions that are actually meeting the interest and the needs, in this case, of the end users. So, and the end users in the case of pork production is anything along the pig production chain, from the farmers until the consumers, using typically a bottom-up approach. So we have advertised this workshop, this event, and the response was actually pretty good. I would like, first of all, to mention that Associate Professor Peter Denberg, also from the University of Copenhagen, will help me in moderating this workshop. He will take care of the chat. So if you have any communication, please write it on the chat. And what I was going to say, Peter, I forgot about that. But anyway, we have also an expected outcome that is a little bit ambitious, but let's see how the discussion will develop. But the idea is to write a position paper, and we would like to involve as many of you as possible, especially the stakeholders. Of course, we need to see if during the discussion this afternoon we will reach areas of consensus, or at least the recommendations that could be made about the future of this production. I should mention that about 150 people have registered for the workshop. I think the attendance online is much lower. We have to consider about 30 people are connected right now. We have to consider also the time. Here in Greece, we are 1 hour ahead. There are people who registered also from other continents. So we will see during the workshop how many we are. It's important that we participate in the panel discussion in the afternoon. So it's not only about the lectures. We would like to create something actually out of this workshop. So moving with the next slide, I think we need to make clear what we are talking about. So antibiotic-free production is not organic production. We are talking about pigs that are raised in conventional farms, and they are the same pigs that are raised in the conventional production. So these are certified animals that didn't receive any antibiotics from birth or from any defined age. It could be after weaning and so on. So it ensured to the consumers that this product has not, or better, the animal from which the product derives has not been treated with antibiotics for a relatively long time or all life. And so within these production systems, you have, let's call it success rate, the number of, the proportion of antibiotic-free pigs range between 60 and 90% of the pigs in the farm. There are, you will hear how this is actually implemented in different countries, and the rules and definitions change slightly between countries. But in general, the main point is that it's more labor demanding. So this requires a bonus to the farmers that is about 1% of the price of the carcass at the slaughterhouse, which nowadays, I mean, there are temporal fluctuations, and there are also differences between countries, but is around 2 euros per kilogram. So we are talking about 2 cents per kilogram of increased cost. And also there are different strategies for the producers to gain basically the money that is being paid to the farmers, and we will hear about that. Interestingly, this experience has had different outcomes in different countries. We will hear that in Denmark was not particularly successful, whereas in France is going pretty well. And a final remark is that the sows can be treated with antibiotics in these farms, and other types of medicines like anti-inflammatory drugs, antiparasitic drugs can be used as well. So after this short intro, I would like to show again the program that is also visible in the flyer of the workshop. I will have this welcome where I will try also to explain what is AVANT and how it is somehow linked to this topic. Then we will have a speaker from France describing the French experience, and it will be online. This is a hybrid event, not only for the attendees, but also for the speakers. So some of the speakers are here, others are elsewhere. For example, the following speaker from Denmark, Jens Peter Nielsen, will present from here. Then we will have Stine presenting the farmer perspective from Denmark, a short coffee break, the veterinarian perspective by Andreas from FVE, and then a second part where Cooper will elaborate, a speaker from Cooper, Arnaud, will elaborate about the antibiotic-free pork production. So after the farm, what happens at the food production stage. And finally, we will have a very interesting talk by Jonathan Rushton about University of Liverpool, about the economic sustainability of this production system. Lunch break, and then the plenary session. And I recommend all the speakers to stay for the plenary session, but also the attendees online, because this is probably going to be the most interesting part of the workshop. Of course, the lectures are interesting as well, but we will have very little time to discuss after the lectures, so there will be possibly room for 1-2 questions if the speakers will stick to the schedule. So I think it's important that We make clear the rules. As a chair, I will have to make sure that we don't get delayed during the course of the workshop. A remark that maybe I should have done from the very beginning is that the workshop is being recorded, and it will be publicly available on the AVANT website. So if you have any problems with that, you can leave us now. And some recommendations for the speakers: stick to the schedule, maximum 25 minutes, even though you have 30 minutes allocated in the program, because we would like to have 5 minutes for questions. And if you can, use the mouse or the Zoom pointer to explain graphs and tables. It's quite annoying sometimes to see a lot of numbers without actually understanding what the speaker says. Then for the online attendees, you are all muted now, and during the morning session you can ask questions after the lectures or during the lectures. But please write them down, indicating in the chat, indicating your name and affiliation. Whereas in the afternoon, you can actually ask your question by raising your hand, and you will have the possibility to unmute and ask the question by voice. And finally, for the on-site attendees here in the room, remember that if you have a question, you will have to use the microphone. Otherwise, the people online will not be able to hear. So, what is AVANT? First of all, AVANT is an acronym that stands for Alternatives to Veterinary Antimicrobials. It's an innovation action, so it's not exactly a research project. It started in 2000, and it will end in June 2025. Some partners have changed during the duration of the project, but we are talking about 16 partners from 9 countries, including universities, research institutions, large industries, and also small enterprises. And finally, one large organization, FV, the Federation of Veterinarians of Europe. The goal of this project is to bring alternatives to antimicrobials closer to the market, so it's not about fancy research, but it's about developing and testing products and bringing them closer to the market. And there is a classification that was actually developed by NASA that is not easy to apply to this type of product/intervention, which is the technology readiness level, as you can see in the graph here. And we are supposed, as part of this project, to move the product or intervention from TRL 5 to TRL 7, where 7 is actually the operational environment, and if you translate it into agricultural terms, that could be considered the farm. So basically, our mission at the beginning of the project was to develop some interventions and bring them from the lab and the animal facilities at our institutions to the farms and see how effective they are. And as I mentioned before, this project is funded by the European Union Horizon 2020. Now, a strategy we had in the grant proposal was to focus on a single disease, and the disease is post-weaning diarrhea in pigs. You may wonder why we did that. Well, first of all, pigs account in Europe for approximately 75% of the antimicrobial usage. If you take into consideration the animal biomass, these are figures from Denmark, where you can see on the left graph that the biomass of pigs is about 45% of the total animal biomass, But when you look at the antimicrobial consumption expressed as kilograms of active compounds, they account for approximately 82% of the total consumption. And within this consumption of antibiotics in the pig sector, more than half is using during the weaning period. So when the piglets are taken from the farrowing unit from the sows and mixed with other piglets, this is a very stressful time for the piglet life. And the main disease that is occurring is post-weaning diarrhea. So basically we chose a disease that accounts for most antimicrobials used in pigs, and pigs accounts for most antimicrobials used in livestock. But beside that, there is also another important consideration, which is on the animal health side. We have banned or restricted the use of certain drugs like zinc oxide and colistin, which were actually extremely effective in controlling this disease. And the main pathogen involved in this complex enteric disease is enterotoxigenic Escherichia coli, ETEC. And this is a truly multi-drug resistant pathogen. It's one of the few examples where actually antimicrobial resistance is a problem having consequences on animal health. So after the restrictions in the use of these antibiotics, different types of compounds are used as a first choice, primarily aminoglucosides. In Denmark, for example, neomycin is by far the most used antibiotics for controlling the disease. And in the graph on the right side, you can see how the percentage of isolates that are resistant to neomycin increased after this aminoglucoside was reintroduced in 2017 in correspondence with the ban of zinc that was anticipated in Denmark compared to other European countries. And you can see the escalation. Don't look at the color because it doesn't really matter, hemolytic or non-hemolytic. We are talking about clinical isolates from pigs that have reached approximately 50% of resistance, meaning that one of two outbreaks is caused by strains resistant to this first-line antibiotic. So we can conclude on this slide that this is a truly one health problem where we are trying to optimize the use of antimicrobials in pigs, actually, and also control or better prevent a problem due to the lack of effective drugs for treating these animals. And the strategy was one disease, but then many different interventions for trying to control this disease. At the beginning of the project, in the first 3 years, we have basically run 4 work packages with preclinical studies, and each work package was dedicated to a specific type of intervention, as you can see on the slide. So work package 1 was focusing on gut microbiome modulators, including fecal microbiota transplantation and symbiotics, so mix of pro and prebiotics. The second one was dedicated to anti-ETEC medicinal products, a polymer developed by the RVC in the UK, and a phage mix developed at the University of Copenhagen. Then work package 3 was entirely dedicated to immunostimulants, so the target was no longer the pathogen but the host, to make it more resilient to the disease, including oral and systemic immunostimulants. And then some work package 4 dedicated to feeding strategies. And where are we now? After 4 years, we have selected the 2 interventions, fecal filtrate transplantation, that I'm going to talk about shortly, and a fiber-rich diet based on alfa-alfa. These were the interventions that were most promising based on the preclinical studies. And 3 trials are being conducted now. Actually, one has just been terminated in the Netherlands, where both interventions were tested, also in combination. Whereas in Denmark and France, only the diet has been tested because we have experienced in the project the challenge that the fecal microbiota transplantation protocol that we have developed is actually not in line with the current EU legislation, which prohibits basically the oral administration of any products derived from feces if the animal is intended for human consumption. So the Netherlands was the only country where the authorities decided to allow this kind of trial on a real farm where the pigs go to the slaughterhouse. And then interestingly, I have to say that there is a work package that has just started where we will try to use the data generated from this intervention to make a projection on what would be the impact if all farms in Europe would adopt the interventions, and also what would be the economic sustainability what is the economic sustainability of the intervention. So a cost-benefit analysis on whether this is actually sustainable or not, which is very important. So talking about the on-farm fecal filtrate transplantation that from now on I will call FFT, this is using feces from healthy sows. So the first step is actually to check that the feces are pathogen-free. Then feces from different donor sows are mixed and centrifuged and eventually filtered. There are actually different filtering steps, and then stored at -80 and finally inoculated administered orally to the newborn piglets. This is actually the protocol that we have developed for testing the intervention in the clinical trial in the Netherlands. So it was an upscaling of the protocol we had used for smaller scale experiments in our laboratory facilities. So this is already an important outcome of the project because from now on there is actually a technology in place, a protocol that can allow a farmer to implement this intervention if the national authority will authorize it. And importantly, this is a non-farm protocol. So the sows, the donors, are selected among animals from the same farm, and this is because we want to avoid the spread of pathogens across farms. So briefly, an example of this is not a workshop for describing, reporting the results of AVANT, but still it's important that you understand who we are and what we are doing. This is a trial that was performed in an experimental farm in Denmark. You can see that piglets are inoculated in the first 6 days of life. Then there is the suckling period, and eventually you can see when the animals were sampled. And then at some point after weaning, actually after 41 days of life, the piglets were euthanized because in Denmark, as I told you, it was not possible to send piglets treated with fecal transplant FFT to the slaughterhouse, and they were analyzed. And I'm going to show you some of the most remarkable results. This is a graph indicating the prevalence of diarrhea, so basically the percentage of piglets displaying symptoms of diarrhea along the study. you can see some significant effect. When you see the stars, it is indicating a significant effect already at farrowing at the end of the treatment. But then the most significant effect was during weaning. This was a farm with high prevalence of diarrhea, as you can see from the control, from the blue bars. More than 50% of the animals were affected at some point during the weaning period. And the orange bars are indicating the percentage of piglets suffering diarrhea in the treated group. So that was a tremendous effect on reducing the prevalence of diarrhea, and also a very strong effect on controlling mortality by 75%. So basically, the treated group has a mortality rate of 4%, much lower compared to the 16% that was observed in the control group. Notably, this includes the euthanasia, because when the animals were displayed severe symptoms of disease, they were euthanized because the design of the study was without use of antibiotics, for obvious reasons, because that would have affected the evaluation of the efficacy of the intervention. So that was very promising. And briefly, some other important outcomes. We have seen again a strong effect on reduction of antimicrobial use in the trial, not as strong as the one that I have shown, but also because the disease burden in this farm in the Netherlands was much lower compared to the farm, the experimental farm that I have just shown. We have shown that diverse dietary interventions based on high fiber content, but especially low protein content, have a significant impact in reducing the use of antimicrobials and the occurrence of disease. This kind of diets, especially the low-protein one, it has a negative effect on growth, on performance of the piglets, but we have also shown that this negative effect is compensated in the following production stages. We have run an extensive phone survey involving several thousands of end users, three categories: pig veterinarians, pig farmers, and consumers, to understand their perception of on the different types of alternatives. And one interesting result was that both farmers and veterinarians are more in favor of the traditional interventions like biosecurity measures, vaccination strategies, and so on, compared to more innovative strategies like fecal microbiota transplantation and phage therapy. So there are also some cultural barriers there, in addition to the regulatory barriers that I have already mentioned before. And another interesting one was that about 70% of the consumers declared to be in favor to pay 10% or more for products, animal products derived from animals that have not been treated with antibiotic. And this is actually a very surprising result compared to a recent study published in 2021 based on a survey in Denmark, where only 1 out of 5 consumers, about 20%, stated to pay more than 10% for pork produced with 20% less antibiotic. So it's a quite big difference compared to our survey, where more consumers, 70% and not 20%, were willing to pay more, but at the same increased the price for antibiotic-free products. And I don't know, actually, as a non-expert in this field, I don't know, there must be some biases here, and possibly the response of the consumers depend also on how the question is introduced. We know from many studies that consumers often declare not exactly what they do when they go in a supermarket. But I think this afternoon is going to be interesting also to discuss this topic, how actually to convince or to understand what actually the consumer wants. Of course, in general, they want a cheap price in the supermarket, but do they really understand the difference between if the product has been comes from an animal treated with antibiotics or not? How much do they care about the welfare conditions of the animal from which the product has originated? So I think that's going to be interesting to discuss this afternoon. Finally, some insights gained by this project. Just to wrap up, there are some regulatory gaps and some cultural barriers that we need to overcome if we want to bring some of the most innovative alternatives to the market, for example, fecal filtrate transplantation. And the most promising alternatives have shown to have an effect in reducing morbidity, mortality, and therefore use of antimicrobials, but they don't seem to be able to eliminate completely the reliance on antibiotics for controlling disease. So if we want to minimize, and here minimizing is relatively also to the initial status, so because in different countries we use different amounts of antimicrobials, but if we, in general, if we have to go below the levels that, for example, have already been reached in some countries like Denmark and the Netherlands, I think the group here has consensus in saying that without impacting, by the way, animal health and welfare, we need to have a holistic approach to reduce the disease burden. And this can only be done by managing the farms and the animals in a different way. And this is where actually the outcome of AVANT links to the topic of this workshop. And I apologize for the very long introduction, but I think it was important to understand this link. So some of the questions, before I give the word to the first speaker, some of the questions that could be interesting to address after the lectures, but especially this afternoon during the plenary session, are: is this production system a viable strategy to minimize antibiotic use down to a minimum? What are the keys to success? You will hear that in some countries it has been a success, in other countries it has not been. So what are the technical factors that can actually, or the cultural factors that can influence the success of this production system? Is it economically sustainable? Because at the end of the day, we can only implement an intervention or a production system in this case if it is economically sustainable for all the actors involved in the production system. What are the negative aspects? Are there any negative consequences? We will also talk about possible negative consequences on animal welfare. And finally, as I anticipated before, it would be interesting to have a discussion about acceptance by all the end users involved, not only the farmers and the veterinarians, but especially the consumers.